Good to see you all. Good to see you, Marinella. Did you put your hand up on purpose? Okay, why don't you unmute, ask your question?
You're still muted, Marinella.
Go to the bottom left of your screen and you'll see a microphone with a line across it. No, you're still muted. Oh, okay, well, she'll be back. Hey, Jeff, Emily, good to see you all. Okay, who would like to share cases today? Jeff, Emily, maybe Sherry.
Yes, Sherry, please.
Okay. So we've got Elena and Marinella. We don't quite have Marinella yet. Elena, do you have cases to share? Unmute.
Hi, not in particular, no, but I do have a question about something.
Okay, cool. Well, we'll start with questions and then we'll go to cases.
Okay.
Okay, Marinella, your question? And if you can't figure out how to unmute, just use chat. And just write it in chat and we'll answer you that way. Yeah. Oh, wonderful. We've got Jane, Laura Lee, Sherry. Okay. Well, because I like doing this and because we're getting to know each other, one sentence, your name, where you're from, and what you do. Emily, go for it.
Hi, everyone. Good morning. My name's Emily. I live in Avon, Colorado in the mountains. I'm working on back to auditing level 1 with Christina. And I've gone through the internship, but I'm going to redo level 1 and work on my cases. And what was the other thing?
That's good.
Okay.
Where you live? Where you live?
Avon, Colorado.
Okay. Jeff.
Jeff Jones, Lafayette, Colorado. Therapist, individual family coach.
Good. And is in my level 2 class. Okay, Marinella, you say you're from Greece, general practitioner. So happy to have you join us. And if you've got any questions or if you can't get your mic working, just please put it in the chat. Let's see what's there. Okay, Elena.
Hi, Elena Holt, Oakland, California, level 1 Christina's class, Bowman Any graduate 2007, 13-year veteran in a local independent woman-owned health food store. Good to be here.
So glad you're with us. Jane, nice to see you again.
Nice to see you too. I am Jane Reynolds. I am a board certified holistic nutritionist. I am originally from England, but working now in Mesa, Arizona, and helping people with their nutrition and their mental health as well as other things. And on the fringes, but like really excited about this, looking at maybe signing up in January. So we're excited. Yes.
And I let Sherry know, but I'll let you and everybody else know as well. We're doing a sneak peek in about 3 weeks. We're doing a 2-day intensive online that's just the lectures from level 1. And it's a little less than half price, but if you do sign up and come, and then in January decide to sign up for the full course, you'll still get to audit all the lectures and everything. And then you'll get the rest of the coaching and actually hands-on training.
Okay, all right. I'd be interested for sure.
Okay, great. I think it will be on our website by Monday, the
Okay.
ability to register for it.
All right, thank you.
Yep.
Sounds wonderful. May I jump in with an intro?
Absolutely.
Hi, I'm Sherry. I live in Maryland now, from New York originally, and I've lived in LA and Boston as well. I'm a licensed mental health counselor, certified holistic health coach. My main passion is integrative mental health and treating mood with food and supplements. My main focus is on myself these days. I've been experimenting with a lot of different approaches, a lot of different tools. I've worked in psych hospitals, addiction units. I'm not working too much right now. The focus is more personal healing, although I'm completing a developmental and trauma, like inner child healing certification this coming week. So that's about it. And I have some questions regarding my own experimentation with the amino acids for today. So hi, everybody.
Fantastic. The 2-day course is starting the evening of the 11th, and then will be the 12th and 13th. So the 11th is Thursday evening, and then all day Friday and all day Saturday. Okay, Mark.
Hello, everybody.
And by the way, thanks, Sherry. Glad to have you with us. Okay. Go
Oh,
on.
great to be here. Thanks.
Hi, everybody. I'm Mark Stiles. I'm based just outside of London in the UK. Graduate of Christina's Trainings Level 2. Yeah, really good to be here with everybody today. Looking forward to it.
Okay, I think we have Hyla left. Welcome, Hyla.
Hi, good to be here. Let's see, I'm doing this from my phone. I'm introducing myself.
Yes, you are.
Okay. Hi, I'm a functional medicine psychiatrist and also have a online CBD business, which I find very useful in my work, which is helping people withdraw from psych meds safely and fairly comfortably. So and there's so few doctors doing it. It's really sad. If anybody knows any more psychiatrists that are doing helping people withdraw from meds, let me know, because I need help. I'm also looking for someone to help me, a nutritionist who is familiar with this process that Christina so wonderfully teaches. So thank you.
Thank you, Hyla, and welcome. All right, let's start with questions. Jeff?
Hey, you forgot me.
Oh, I forgot you. You're right, I did. I'm so sorry. Go for it.
Hey, I'm Laura, and I'm in Oklahoma City. And I'm in Christina's level 2, and we just started, and I'm so excited. So I own Infinity Wellness and Lifestyle Solutions here in Oklahoma City. I meet with individuals, and I'm certified everything from yoga, Reiki, aromatherapy. I've been studying natural health modalities for about 20 years, and I'm in recovery myself. I'm coming up on a year alcohol-free. I recently lost my mom and my brother to complications from alcoholism. And so I'm very, very passionate about helping people in recovery. And this has been a huge blessing. I'm excited about the future.
Well, we're so happy you're with us, and nice card. Okay, Christy. Do we have you, Christy, yet? No. Okay. Let's start with questions. Jeff?
Okay. I have a number of questions here. one is I was realizing that I needed to know more about fats, specifically with, people who have ancestry that puts them vulnerable to alcoholism from the omega-6 deficient kind of perspective. And so one of the things I've been doing is a lot of what I consider pretty normal things, fish oils and GLA, and trying to get omega-6s in them with diet changes. So, and, just this morning so one of my things, one of my, information addiction things is reading Mercola's emails on a regular basis. And this morning, one of the things that I was reading here was it really makes sense to avoid omega-6 linoleic acid, and which I didn't really understand what that was about. So I'm asking a couple different questions. One about the difference in fats and how best when someone is deficient, just do the fish oils and that balance and assume that's good, or so that's
Okay.
one question. Then the other is this GLA thing.
Okay. And maybe I'll create a community forum in the next month or so exactly on that question, so we can do a deeper dive than what's appropriate here. I'm trying to think how to best answer it. I'm just really going to talk about the omega-6 question. You might also want to review the parts of the lecture in level 1 where we talk about fats, because that's in the third month. So omega-6 fatty acids are both from vegetable oils, as well as arachidonic acid, which is an omega-6 fatty acid, comes from animal fat, and especially animals who have been fed these grains, such as corn, which, and even wheat, which a lot of animals really shouldn't get too much of. So arachidonic acid is pro-inflammatory, and it creates PGE2, which is our whole cascade of pro-inflammatory chemicals. It's not the only source of pro-inflammatory chemicals, but it is certainly one of them. Now we have PGE1, which is anti-inflammatory prostaglandins, and we get that from GLA. And our body is supposed to make GLA out of vegetable oil, out of the omega-6 vegetable oils. There's a little conversion process, and all of our bodies are supposed to be able to do that. And then GLA turns into PGE1. However, some of us don't do that conversion very well. That conversion is blocked. And there are several things that can block or partially impair that conversion, including, according to early research, and I don't know how much that research has been replicated. It needs to be much more deeply researched. Anyway, there's research and clinical experience that shows that people from the Scandinavian and Gaelic parts of the world, and possibly also some coastal Native Americans, have a genetic inability to convert these vegetable oils into GLA and therefore PGE1. This is why we can bring it in from borage oil, evening primrose oil, even hemp seed oil, and some others as well. Very helpful for skin conditions and depression. When PGE1 is low, and especially genetically low, people can have lifetime depression. I was certainly one of these people. That is only relieved by alcohol. Apparently, the histamine levels from alcohol can potentiate PGE1. I don't thoroughly understand it, but I have definitely experienced the benefit of borage and evening primrose oil. You can do a blood test. There's various companies that non-medical practitioners can order. You can just go online and look around. I think you can also get it from dhalab.com. And you can, I know you can do a finger test, finger prick test, as well as just a blood draw. And find out exactly what your ratio between the omega-3s, the omega-6s, your GLA, your cholesterol, kind of all of these different types of fats, your phospholipids, et cetera, all of which are very important and have different roles. But the blood test will tell you what your ratio is and therefore what you need to get more of or get less of. Anybody else want to, who may know more than me, want to add to this?
Is there a specific name for the blood test, Christina?
Just an essential fatty acid
Okay.
profile. I think you can also get one through Genova. Valsa, yeah.
Okay, so I can add some stuff. So omega-6s are, I guess they are vilified in many communities, but actually it's very important, including arachidonic acid.
Mm-hmm.
When kids don't have enough arachidonic acid, they actually have brain issues. So there are many different kinds of arachidonic acid, as you were implying before. There's, you know, linoleic acid, then there's GLA, there's arachidonic acid. And some of these omega-6s go on to making eicosanoids, which are very helpful molecules. Some of them are pro-inflammatory and some of them are anti-inflammatory. So it's very, very important for us not to vilify it. I saw the Mercola article and I was also surprised about it. What I would say is that the reason he might have said it and the reason it's maybe vilified quite a bit is because we tend to get a lot of omega-6s in our, maybe in our diet and not so much omega-3. So people sort of say, you know, arachidonic is not so good because it's pro-inflammatory, in a sort of generalized sweeping statement rather than specifically for a patient. So maybe in a general sort of way, yes, you know, having lots of omega-6 is not good for us compared to omega-3. So that ratio is important, the omega-6 to, sorry, the omega-3 to omega-6 ratio, whichever way you want to look at it. So omega-6s are important, but maybe not in excess of omega-3s. And in terms of where would you test them, so there are different kinds of tests. You can do a plasma test, or you can do a red cell membrane test. So a lot of people prefer actually looking at red cell membrane to test fatty acids, as opposed to the plasma, which you can get from a company like Quest. I don't think LabCorp has it. But the ratio, if someone can't afford to have the private test, and Omega Quant is one of them, and BrainSpan is another one. I like Omega Quant, it costs about $99. And what they do is they look at the cell membranes and they break it down, omega-3s, omega-6s, and the different kinds of omega-3s and omega-6s. So you can get the test, it's relatively inexpensive. And so what you're doing with that is, what they say is that the percentage of omega-3s compared to omega-6 should be about 8 to 10% is ideal. And that's what you would do with that test, is trying to push up the omega-3s, and then you can look at the specific omega-6s.
All right, thank you, Valsa.
Thank you very much.
Jane?
Yeah, the only thing I was going to add, because also you have a wealth of information, and it was not the fats piece was not my favorite topic in nutrition school because it's so complex. But one of the things that runs through my mind too is just going back to what you said, Christina, about the quality of what we're putting inside of our bodies anyway. So if we're getting our omega-6 fatty acids, and we're getting them from our French fries, and we're getting them from corn chips, and we're getting them from animals that have been fed feed that is not in keeping with their natural diet, plus they're stressed out, plus they're not being husbanded in the keeping with the way that nature intended them to be kept, right? That drives up that pro-inflammatory state before we even get it inside of our bodies. But when we're dealing with things like GLA or borage oil or blackcurrant seed oil or evening primrose oil, they're not at that state where, and I know you talked about the genetics of being able to convert, but if we're putting in quality products that have not reached that pro-inflammatory state before we even put them in our bodies, that's a big difference from, from the two pieces.
Because then we're already getting it. Yeah.
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 Yes.
I mean, if you get your grass-fed beef or your wild game, if you're, from a hunting family or community, those animals already have much higher levels of omega-3s and much lower levels of the pro-inflammatory omega-6s in their fat composition. This is one of the reasons why it's so important as to where you source your animal proteins from. Yeah. Valsa.
Okay, 2 comments. So not all omega-6s are pro-inflammatory.
Right.
Some of the eicosanoids that they do make are very important for, I think it's actually the GLA one.
It is the GLA, yeah.
That gives us. So the other thing to keep in mind is when we give fatty acids to patients, they can oxidize them. So often, I don't know how often we emphasize that we should make sure that they're also getting antioxidants with it, like vitamin E, A, maybe CoQ10, because often if we just give, depending on the oxidative stress for the individual, if we do give them excess, if we're supplementing them with fatty acids, whether it's omega-3 or omega-6s, is to keep in mind they can oxidize it and create increased oxidative stress, destroy the cell membranes even more. So something to keep in mind is to give fat soluble antioxidants like A, E, CoQ10.
Mm-hmm, mm-hmm. Right. And that's because these fats, if you remember how awful rancid fats smell and taste, they are oxidized. And so when, fats go rancid in our own body, that oxidation is also pro-inflammatory through other pathways. So thank you for that. All right. Any other questions? Jeff.
Thank you very much. I really appreciate the wealth of information that is at something like this. Other questions that I have are, so Joan Matthew Larson stuff, I have spent a lot of time looking at that and ongoingly do. And I know that's old stuff and a lot has changed since then, but she mentions chromium and niacin being very helpful for, people in early recovery from alcoholism specifically. And I know there's different schools of thought on so many of these things. And like what I recommend as far as a multi is the pure encapsulation stuff. Mm-hmm. And I am wondering, is the niacin and chromium stuff covered with a multi like that, or would in addition to that be helpful? And then of course the other question is how do I know when it would be helpful if in fact additional chromium and niacin would be helpful?
Oh my goodness. Okay. Cannot answer that question in full in this format, Jeff. We don't have anybody from the Alliance here right now, but my understanding is that next month, the Alliance teleseminar is going to be hosted, or the speaker is going to be Dr. James Greenblatt, who's one of the top integrative psychiatrists in the country. And I think he's talking about niacin.
Okay.
Okay, I'm not 1,000% sure, but I think he's talking about niacin. Anybody else want to take those questions and run with them for a few minutes? Let's not take more than 5 minutes, but who wants to jump in and take 5 minutes answering those questions? Otherwise, I will, but I suspect there's some people here who can do a better job than me. All right. If anybody wants to add to what I'm about to say, please do so. Chromium is a very essential nutrient for blood sugar management, both for diabetes and hypoglycemia. Hypoglycemia is often considered to be a pre-diabetic state. And there is some significant research out there that suggests that people have, well, we know for certain that a very large percentage of people with substance use disorders are clinically diagnosable with, or medically diagnosable with reactive hypoglycemia, which means that after a sugar challenge, their blood sugar can drop down to 50, which is way, way, way too low. After spiking, it first spikes and then it drops very quickly. Okay, there is some indication that that exists prior to the substance use disorder, and in fact may even be a causal factor. So since chromium is very useful in stabilizing blood sugar levels and is part of our glucose metabolism process, making sure we have enough is important. I do not personally know how to make sure we have enough. I suspect there are tests out there that can tell us. There are different formulations that have more chromium in them than others. I would have to look up the amount that's actually recommended for blood sugar stability. Does anybody know the amount of chromium needed, Elena?
I have always 200 micrograms 2 to 3 times a day.
So you're talking about around
Chromium.
600 micrograms of chromium a day then?
Yeah,
Okay.
like I tried it years ago when I was with Bowman, like just for the heck of it, and it was pretty remarkable actually. Like you would, like my weakness is breads, good bread. What's not to like? And or sugars or breads. You take that chromium every day, and in 2 or 3 days, it's like you start to go for your thing, and you go for it, and you go, what? Why do I want this? It's really interesting. Yeah.
All right. Anybody else want to add to that regarding chromium?
I think I might have missed the talk. My computer was acting funny. I can talk a little bit. I mean, you probably answered all of it, but are there any specific questions?
Well, just if there's anything else you think that we should know about chromium before we move on to niacin. Okay, great. So there we have it, anywhere between 400 to 600 micrograms of chromium a day, however you get that. If you have blood sugar control issues, and pretty much everybody with substance use disorders do. Okay, niacin. In the early 50s, Dr. Abram Hoffer and Dr. Carl Pfeiffer and a couple of others, those very early orthomolecular psychiatrists, began experimenting with the use of niacin to relieve alcohol cravings and cravings for symptoms of schizophrenia. they introduced this concept to Bill W., who's one of the co-founders of Alcoholics Anonymous. And he jumped on this and found that niacin was particularly useful to him. And he actually did a variety of studies with some of his buddies in AA who had cravings and symptoms of schizophrenia, and found that supplementing with the niacin, I think it's 1,000 milligrams a day, but I don't remember, was profoundly useful. There has been, it kind of dropped out, and I particularly have never been one to use niacin, and I keep telling myself I need to, but the reason I don't is because some people with high histamine, who are already running high histamine, niacin can create a histamine release in the body, and that can be extremely uncomfortable for people. It feels like a rash or a sunburn, and some people only get a mild reaction. Other people can get a very significant reaction. It turns out that this is actually in response to either we'll get there, in relationship to either under or over methylation. When Joan Matthew Larson wrote her book, and when they first started doing some of the research with niacin, methylation hadn't been identified and wasn't understood, and its relationship with histamine levels wasn't understood. It now is, and researchers and practitioners are kind of trying to sort everything out. And so because of that, I really never jumped on that bandwagon. But there is good, solid research that indicates that taking niacin by itself, or even niacinamide that tends to have less of the histamine flush associated with it, can absolutely reduce symptoms of psychosis and alcohol cravings, I think, irregardless of your methylation status or your histamine level status. I could be wrong about that, but that's my current understanding. NAC, well, NAD, it's not NAC. NAC is N-acetylcysteine. NAD is I may get this language wrong, enzymatic metabolite of niacin that is involved in a lot of metabolic processes in the body. A lot, including energy production, and it kind of helps run things. So that when NAD is low, people can have serious problems running processes in the body, including neurotransmitter production and function. So there are an increasing number of clinics in the country who have jumped on the use of who have jumped on IV NAD because you can really make a lot of money off it. And some people are also using oral NAD, which I think is probably a really useful idea. And again, isn't something that I have a whole lot of familiarity with. So is there anybody in the group right now who can take that in about the next 2 minutes and run with it? NAD. Hyla? Balsa?
So
Yeah.
I can talk about NAD. Oh, Hyla, go ahead.
Hyla, go for it.
I'll defer to Valsa first because I'm having some technical issues.
Okay. And by the way, I just want to introduce Valsa really quickly. She's for those of you who didn't hear, she's an integrative medical doctor from New York City, specializing in addiction and other mental health issues. Okay, go for it, Valsa.
Okay, so So NAD in general, so it's one of the end metabolic products of tryptophan, right? Like when we think about tryptophan, we can think about serotonin and we
Right.
can think about melatonin. It also produces niacin. And as Christina said, NAD is one of the forms of niacin. So we use NAD in our body for thousands of reactions, as Christina said. But one of its most important uses is in the citric acid cycle, where it is used for in the electron transport chain as one of the final processes for getting ATP, which is our energy currency. So you need NAD for that. And what I would say is perhaps many of our patients who use substances, their mitochondria might not be working as well as they should to give them energy. And that's because you need a lot of nutrients to get the citric acid cycle working. You need a lot of cofactors. So if you don't have enough of that, just as the result of their using substances and not eating well, they're not going to make NAD in sufficient quantities to be able to give them energy. So giving them NAD sort of short circuits the whole citric acid cycle in a way. That's just the one mechanism. And then, they can get energy, sort of helping the mitochondria. And one of the functions of the citric acid cycle, as I said earlier, is to produce NAD, which gives energy. So when you give NAD, it helps the electron transport chain give
Right.
ATP. So that's one of the mechanisms. And I wonder, so the other one is that when someone is using alcohol, they need NAD to metabolize the alcohol. Like alcohol goes to acetaldehyde, then acetic acid, and eventually is like blown off or excreted off.
Excreted. Yeah.
So in that pathway, you also need NAD, actually, like one of the forms of NAD to be able to metabolize the alcohol. And one of the problems with alcohol, one of the reasons people get into liver related problems, I think, is because they may not have enough of the forms of NAD. And I wonder if giving NAD would help with that.
Interesting. That's a really interesting supposition. Yeah.
Well, it's not, I guess the supposition is, I'm not sure if it's the NAD version or the NADH. So it's the oxidized and reduced versions that they're short of. NAD is definitely needed for that metabolism.
Yeah. All right. Thank you, Valsa. And so there's a little bit of controversy out there as to whether clinics should be using IV amino acids or IV NAD. And I personally think they should be using both, because NAD IVs don't do what your amino acid IVs do. And a lot of people seem to think that the NAD, because it can be very, very helpful in reducing cravings, and just because it's just getting people's systems working much better, but it doesn't therefore necessarily rebuild your neurotransmitter systems. And so we do actually at times need to be flooding the body with these amino acids to more quickly rebuild neurotransmitter systems. And having sufficient NAD for energy, having sufficient ATP in the body is necessary for the conversion of amino acids into neurotransmitters, and therefore neurotransmitter function, because nothing runs in the body without those little ATP molecules. All right.
I have a question. So are there any protocols for the use of IV amino acids that someone is using in addiction, like protocols that we can have access to, like that's like these are the kinds of amino acids we may need for IV, I'm talking about for.
Yes, there are. They appear to be a little slippery to find. Dr. Blum definitely has a formula. Merlene Miller, who just passed away, has a formula. So I suspect her husband's holding it, and her company, which is called New Pathways, NU Pathways. There is a woman in Canada, Mark, do you remember her name? Who says she has Dr. Hitt's original formula.
and there's a couple of others floating around.
I'll have a look. I'll
Okay,
come message it if I can find it.
yeah. And she's actually licensing that particular formula.
Christina, did we talk much about NAD use in level 1
We did not talk
alcohol
about it.
use disorder?
No, we talked
did.
a little bit about niacin.
Okay. Do you know of any studies, NAD use for alcohol use disorder?
There's probably quite a bit of it. And we know that Dr. Hitt, who was one of the first people to do a IV amino acid detox program in Tijuana, was actually using NAD along with his amino acid formula. But Hyla, do you know of any research on NAD and alcohol use
Yeah,
disorder?
there's a lot. There have been some conferences on NAD. There's a lot of information. Dr. Metier in Louisiana, Springfield, Louisiana, has the original clinic that was doing it and teaching it. And there's a lot of literature. I can pass it along to you. I can't do it right now, but I could get you some literature and citations and whatever. And there's a lot of information about the IV aminos. I don't think you have to pay anyone for it. Stan Stokes's center used it. I don't know if they still
Yeah.
do.
My understanding is that they don't.
Yeah, I mean, they're more easily attainable. I mean, you don't have to pay somebody who's licensing somebody else. I mean, I think that's a bit of a racket, if you ask me.
I agree.
You know, you amino acids are readily available. You put them in the IVs, and you know what aminos you need for which conditions, and you also can test for deficiencies.
Right.
So like
Exactly.
Beth McDougall in Marin County has been using IV aminos for a long time, and there are quite a few practitioners who do it.
Dr. Bellica in
Oh, right, sure.
Loveland, yeah, uses IV aminos with Inner Balance in Northern Colorado as well.
Right, so you could just check with him.
Yeah. Laura, you should actually go visit them at some point.
Where's that?
You too. Maybe you guys can get together. And oh no, Laura, you're not in Colorado. Sorry, I thought you were. You're in
That's Emily. Emily's in Colorado.
Yeah, Emily's in Colorado. Right. Right.
But I'll
You're
go to Colorado. I'll have any excuse to go to Colorado.
Well, a couple of years ago in a Mark's advanced class, one of our students did her internship in person by going to Inner Balance and got permission to live there and be part of their treatment team for 3 months for her internship group. And so we all got to learn intimately what was happening at Inner Balance, which was great fun.
Well, if they'll take me, I might consider doing that.
You know, yes, you would just contact them, let them know that you're in my course, and I think they'd be very happy to work something out with you.
Okay.
Okay, let's jump into cases. We've got Marinella's mom. We've got a couple people. Who wants to go first?
I have one short one also I'd like to ask questions about.
Why don't you start? And then let's try to keep things moving along.
Okay, concise. So I have a 46-year-old male who I've been working with who has stopped using alcohol and marijuana. He had a history of 18 years of marijuana use, and he has been since stopped for, I think it's been at least 7 months or so, 8 months. But he has been struggling with anemia with his blood work. And I just listened to Why Isn't My Brain Working, the audiobook for level 2. And she brought up how H. pylori can be a cause of anemia. So I want to know as much as you guys know about that. What's the testing for H. pylori that's the most effective, and so on.
Okay, well, I will jump in very quickly and then let the doctors take over. So H. pylori is a bacteria that can cause ulcers. And the genetic disorder, which is not H. pylori, but sounds like it, pyroluria, can lower the production of hydrochloric acid in the stomach. And when hydrochloric acid drops, we are much less able to, we are not able to convert iron into its absorbable form. I think ferrous iron into ferric iron. I might have that backwards. And so that lack of hydrochloric acid in the stomach can lead to anemia. But your question was about the bacteria H. pylori. Anybody?
What's the best test? What's the best test there? I Googled it and it was stool sample and a breath test. Like you can take urea, I think, or something like that, and then blow into a device and it will produce a gas that's detectable.
Volsa, how is H. pylori detected and diagnosed? Because it's treated with antibiotics and it is commonly considered to be the cause of ulcers nowadays.
Yes. So in terms of anemia, I would figure out what kind of anemia it is. I would, someone needs to figure out what kind of anemia. There are different kinds of anemia from a medical point of view. It's when you say it's from H. pylori, there can be many reasons for that. Is it a B12 deficiency or is it from bleeding from an ulcer? So I wouldn't jump to H. pylori. I don't know what other work. I would do the workup or have someone do the workup for anemia first to see if it's a bleeding kind of anemia. Is it a B12 folate deficient anemia? Is the bone marrow not working well? So those are like the broad generalizations, or like a hemolysis, broad generalizations of cause of anemia. Deficiencies versus bleeding versus bone marrow dysfunction. That's
well, it's the main lab test also. It's causing low iron, and they had him on iron supplements every other day to prevent constipation, but now he's taking it every day. It's still slightly low.
Okay, so you need, this is on the side. Sometimes providers just sort of look only at iron studies. They may or may not look at B12. I know it's not your purview to check these other things, but so if someone has anemia, not only do they need iron, they might also need copper. Again, something that you may not be aware of and you need to be aware of. So anemia is not just about iron. There's so many other things going on. But say this person has iron deficiency anemia. So if that's the reason that they're saying that this person has anemia, is it a female or a male?
Male.
Male.
So for a male, if it's a certain age group, if it's an older male, then you think about colon as the source of blood loss. So when you think of a low iron, you think of bleeding, and then you think of, younger versus older people. So if it's the older folks, we think, we need to do a workup looking for cancer over the age of 50. But this is just from a medical point of view.
Right.
I'm a doctor, and I'm telling you from a medical point of view and our algorithm. But in general, if you're sort of saying it's H. pylori, and I think it's H. pylori, now how do we work up H. pylori? So for H. pylori, you can do a blood test, stool test, breath test. And that's the conventional covered by insurance model. So in general, I don't think any of those are great tests, but I think conventional doctors would probably go with the breath test, number 1, stool test, number 2, and maybe the blood test, number 3. But in this era of COVID, I think they're going directly to blood tests. So, but they're not that great, the conventional model. But from a functional medicine point of view, there are stool tests that we do that actually look at PCR, and there are these functional medicine tests that you can do where they're looking for H. pylori, like Diagnostic Solutions does. Yeah, Diagnostic Solutions does testing for H. pylori, and they're looking for H. pylori, and so does probably GIFX and Doctor's Data.
Okay, and so you can order those through DHA Lab. Okay, thank you so much, Valsa. I don't want to spend a lot of time here. I'm going to throw in one more cause of low iron showing up in blood tests, which I just got discussed in my genetics class, which I'm just throwing out for the fun of it. And that is that hydroxy radical formation from iron overload can actually cause low iron to show up on blood tests. So the problem is actually iron overload that's gotten oxidized, is causing inflammation in the body, but it's showing up as low iron. So I found that really interesting. Okay, moving on. Next case. Thanks, Laura. Marinella, shall we do your mom? Okay. Why don't you, okay, you said that she has chronic pain at nighttime, predominantly in the legs and soles. Can you give us more information, especially what has been ruled out, what you've tried and hasn't worked, and kind of where you are now with it? You can just type it in the chat. If you can't get your microphone working. While you're doing that, Elena, what's your quick question?
Hi. I think it's going to sound crazy, but neurotransmitter wise, okay, it's someone like who I know, but they're not willing to get down and work with it, who has many kind of issues, but who in the last couple of years, is there like a specific neurotransmitter that causes a person to become obsessed with cosmetic surgery? That's crazy. I told you.
No, it's actually a really good question. And where my mind first goes, we'll see what the rest of the group thinks. My mind first goes to low serotonin. And there's two reasons for that, okay? One is anything obsessive is frequently a reflection of low serotonin. And secondly, cosmetic surgery is about wanting to look better. The reason why we want to look better is because we don't like the way we look typically. And the emotion around not liking the way we look is shame and low self-esteem. And shame and low self-esteem can also be signs of low serotonin function.
And this person also is back on an SSRI. She's switching now from Prozac to Zoloft and takes birth control and has had a lot of recent man trauma, let's say, not physical, but but she's
well,
a
so
tough
this is where,
cookie.
Elena, if she's willing to do anything, you first go to the chart, because man trauma may indicate the low endorphins, right?
Mhm.
And long-term contraceptive use is going to indicate probable and possible depletion across the board nutrient-wise, because they deplete the body of a whole slew of nutrients. And so maybe just getting her eating well and on a good solid multivitamin replacement would be a good place to start.
Yeah.
It's clear that the SSRIs are not working. So it would be wonderful if she could just come off it all and do replacement with precursors, but you know, that's probably not possible right now. But you start sideways, okay? And actually, what Valsa said about niacin being one of the products of tryptophan. So when tryptophan's turning into niacin, it's not turning into 5-HTP. So sometimes bringing in some niacin can spare tryptophan to create more 5-HTP to create more serotonin. Okay.
All right, thank you. And then the other thing was, it's not case related, but the wonderful Mark and you, the electronic transmitter thing. I
Yes.
did the form and got the email saying, you did it great, but I've sent 2 emails and I haven't gotten the link to get the $10 admin access to use it with clients. Anyways, just throwing that out. And the last thing is, I personally have been, I guess it's not trialing anymore, since September 12th, the tyrosine, and tyrosine is my friend. And it is my friend. It's my friend. Anyways, thanks. I love you all.
Okay, Mark will private message you about the $10 thing.
I'll pop the link in the chat for you.
I have a quick question on that same topic for Mark. I did sign up for it. I paid the $10. I'm logged in and everything. And I'm pretty technologically savvy, and I cannot figure out how to send a link to a client to have them fill it out.
You'll get an email this afternoon with it.
Okay, great. Thank you.
I'll catch it. Yeah, we'll catch a one-to-one as well to run through it.
Right on.
Yeah,
Thanks.
Mark, I want that too. I need to sign up and pay and get going on that too. I'm ready.
I'll pop the link in the chat box now. And you can bob through there and sign up, and then I'll catch up and do a kind of one-to-one with you all as well.
Yep. And we're actually going to put just a little hold probably till Monday on new signups. And then we'll be free to go. But, you know, we will be having classes on how to use it. Okay, Marinella. I see sorry, but I don't see anything else from you. Oh, did she go? Oh, no, there you are. Okay, can you share us your story?
You're muted.
Yeah, she doesn't know how to unmute, or it's not, the unmute button is not working. Only in the nighttime. Okay, and it's her feet as well as her legs. Are we sure that it's not a chiropractic issue, that the sleeping position is putting pressure on some sort of nerve? So whole body would include face, shoulders. Does it feel muscular or skin or nerve? So have you tried Epsom salt baths or either oral or topical magnesium? And does it not help? What about GABA? Yeah, but sometimes people need more magnesium. It doesn't mean that it's actually doing its job. Okay. Have you tried the Epsom salt baths? Okay. What about GABA? Have you tried GABA? What dose? Oh, okay. The magnesium's not been helpful. Got it. Have you tried GABA? So one of the signs of GABA deficiency are tight and painful muscles. And we know that stress uses up GABA. The GABA is released, and fired when we are under stress. So the fact that it gets worse when she's stressed, and that it appears to be muscular, could actually be a reflection of GABA deficiency, especially since the magnesium's not working and it doesn't appear to be like a nerve issue. Oh, she has Parkinson's. Well, that's definitely a clue. So, Marinella, I would start by learning how to use what our assessment tool, which is the amino acid therapy chart, or even just starting with GABA supplements. I think the more we can lower her stress and support her neurotransmitter function around stress relief, and this can be both supporting serotonin and GABA, but also blood sugar control. I would try GABA, either GABA by itself or one of the GABA formulas. And you can use it during the day to help her deal with her stress during the day, as well as at night. Now, you see, that's true. But the question is, where is the stress experience coming from? Okay. Yeah, I like the idea of CBD here. Homeopathic St. John's wort, hypericum, is also indicated for nerve pain. Bentotiamine, which somebody already suggested, is useful for nerve pain. It's a derivative of thiamine, or a form of thiamine that appears to be especially useful for nerve pain. And then using, functional medical approaches for the Parkinson's is also like supporting, glutathione. But bye, Laura. Hyla, can you respond to Sherry's question about CBD? But Marinella, I would start with GABA. I like the True Calm formula because it has a little bit of valerian in it. Valerian's a muscle relaxer. but you and I could set up a private conversation to go into it in more depth as well, okay? Yeah. Yeah. Okay, Hyla, could you answer Sherry's question? Is it common for somebody to have no reaction to CBD or even a lowered mood?
Sure, it's not at all common, but it is also, it's an anti-anxiety and also a sleeper. People take it at bedtime, so it could actually just kind of slow you down. It could feel like lowering mood. I've had people get anxious on it. I've had people take it at bedtime and not be able to sleep. I mean, the opposite of not being able to sleep, like worse insomnia. It's unusual, but because everyone's different, you know, you have to allow for variations. You may want to try a different brand, a different amount before giving up on it. Do you know how much they were taking? I can't hear.
Unmute.
Hi, I think the dropper, was it about 25 milligrams? Should they maybe try more?
Yeah, that's a good dose. You know,
It's a
I tell
good
people to
dose.
start even like on 12 and a half, 25, they
really?
can go up to 50. She can go up to 50.
Would the products with terpenes be more helpful possibly?
Possibly, yes.
Yeah.
Do you know the brand?
Have to check, not offhand.
Okay.
Yeah.
Yeah, it's so variable. You know, some people
Sure.
have, you know, a lot of people have really good results and some people don't, and they have to fool around with it a bit. And some people just aren't good candidates for it. You know, but
Right.
so many symptoms to a low endocannabinoid system, you know, everything from migraines, muscle pain, anxiety, all kinds of pain, depression, cardiac issues, bone loss. So it's all
Sure.
it all raises the endocannabinoid system. So I'm a big fan.
Yeah, thanks. The person's dealing with anxiety and depression and has gotten off of long-term psychotropics. So is just trying different things at this point. Yeah.
Yeah, I use it a lot in helping people. Along with the amino acids and other cofactors, I definitely use CBD. I added it to one patient who was she had pyroluria and was on a number of meds, and we're gradually lowering it. And what really worked finally, and she was having anger outbursts, and what finally worked the best was CBD. We gradually increased it where she's having fewer anger outbursts. But this is where actually, Christina, what would you recommend? You know, I'm watching her blood sugar. I mean, it's kind of a broad question. And I'm in the middle of, are you finished with your question? I mean, can I ask this question?
Oh, very interested in your question, but was also wondering if maybe a product with a slightly higher level of THC might be more helpful.
Well, then you'd be going to a dispensary. Then you're not in the realm of CBD, which is not my realm either. CBD is 0.3% or less of.
Okay,
THC.
Got it. Thanks.
Anger.
Can I talk to you?
Oh, Marinella, yes, hi.
Yes. Hi, I'm unmuted.
Oh, good. So glad.
I'm so happy to be here with you.
Oh, we're happy to have you.
Of my heart for all this initiative, and you're great, I think, and very innovative. And you're a ray of hope for people that have no hope anymore with chronic pain or, I don't know, addiction and everything I hear about. And I really appreciated this free session. I wanted to ask you, can I?
You know what? I want to, Marinella, I want to take Hyla's question first, and then we can jump to yours.
Okay.
Hyla.
Yes.
Your question.
23-year-old girl living with her mom, getting off meds, very high score on her pyroluria. And anyway, so with the amino acids and then adding in CBD, she's been doing so much better because her mother was like walking on eggshells with her. I mean, that's hard. They've been kind of stuck together. She does go stay with her father sometimes too. Anyway, that's
What's her copper?
That's a good question.
And the reason, everybody, I brought up copper is that,
Thank you.
Yeah, this woman probably has pyroluria. And one of the things that happens with pyroluria is that zinc drops dramatically. And when zinc drops, copper tends to rise significantly. And angry outbursts and violence and that out there stuff is a sign of copper toxicity.
Of course. Yeah. I mean, I know I ordered it, but I don't know if they did it.
Okay.
I remember there was some question from the lab. It was Quest. Let me get.
Yeah, because we want the zinc copper profile.
Yeah. Which I requested. Let me see what they.
Or a ratio, I should say.
Yeah, let me defer that for later. I need to look for it.
Okay, cool.
And I don't think I have it. Okay.
All right. So
but she's on high zinc.
Okay, so that may be one of the reasons why she's slowly getting better, and it may just take more time.
Yeah. How high would you go on zinc?
The highest I've run across in people recommending is 100 milligrams a day. But I really don't like supplementing with zinc over a period of time without knowing what copper is doing.
Yeah.
I have an aversion to that. And then, of course, low serotonin can lead to irritability and anger as well. But, you know, as her pyrols come down, you know, her serotonin is going to go up.
Okay, so is serum copper as opposed to plasma copper, which I couldn't get it.
Oh, okay. So you may have to go to DHA or one of those other companies.
Yeah, but that's really good idea. Thank you.
Okay. All right, could everybody just put their hands up who wants, we've got just about 45 minutes. So how many more cases do we have to do? I want to make sure everybody's getting their needs met. Sherry, who else? Marinella? Just 2 people for cases? Great, I'm gonna go with Sherry and then we'll go with Marinella. Sherry, jump in.
Thank you. Hi, I won't be long. Actually, it's partly a comment on like the wonder of it all. So I hope you're not uncomfortable with a little self-disclosure. Christine is very gracious with her own self-disclosure. So yeah, I'm a licensed counselor, integrative health coach, a lot of things in my background, but the impetus for jumping in more fully in recent months and last couple of years with integrative mental health nutrition and now amino acids is, no surprise, my own stuff. Okay. So thank you, Christina. Welsh tests, great. I've been experiencing a morning, it's more than anxiety, folks. It's like literally terror. Okay. And I don't mind sharing, I come from a significant trauma background, which I've been dealing with lifelong on the life path, right? This is very interesting. This morning, I want to share, I woke up, can we call it grace? Can we call it, I ate some good tryptophan containing proteins yesterday. I woke up feeling great this morning. Okay, so this is a little confusing. It's like, yeah, of course, we'll take it, fine. But I can't be scientific about it. I've been experimenting with 500 tryptophan at night, 5-HTP and theanine in the morning. Oh, what's that nice friendly one we take during the day as a mood brightener? Trying to think of that one. Anyway, I've been picking up on the suggestions and trying to go more deeply into the amino acids, which is great. And then suddenly this morning, I've only been trying the amino acids for a week or so. This morning, I wake up fine, right? So it's just an interesting thing for me to ponder as a practitioner and just a human being on my own healing path. You know, I'm also, yes.
How much 5-HTP and tryptophan did you use yesterday?
I didn't take it last night. Yesterday morning, I took 200 theanine and 100 5-HTP.
And that's all the serotonin support you did yesterday?
Yes, other than intermittent good quality proteins.
Okay. So it's not as if you kind of overdid, because night terror, when I think about morning terror, yes, I go to PTSD.
Right.
I go to night terrors are often a sign of low serotonin. Whether that's also true for morning terror, I'm not quite sure.
Right.
But morning is still a continuation of the night. So maybe 100 milligrams of 5-HTP is not a lot.
Okay.
What about magnesium? Did you take any magnesium yesterday?
I did. It's probably only about 150.
So that's very low dose, but sometimes people don't need very much. I mean, it's a myth that we always need really large amounts of things for large symptoms. Sometimes we only need little amounts of things for large symptoms. There is research that magnesium can lower the amygdala signal of fear.
Okay.
Now, some of that study research is coming out of the use of magnesium threonate, which they're saying is the best for getting into the brain. I don't know if that's true, but I do know that the research around magnesium indicates that it actually shifts the amygdala signal and calms it down. And of course, the amygdala is going to be one of the sources of terror.
Sure. Sure. Not to go on too much, I just thought it was interesting to bring to the group because we have our psychotherapeutic hats here, we have our biological hats, and sometimes it's hard to put your finger on what helped, right? Because I'm also completing training as a trauma therapist. So I look at both those angles. How much is it? This person, whether it's myself or a client, is listening more to their wounded inner child. Or, yeah, hello, right. So yeah, I guess we're going to conclude there are different pieces to the puzzle and we do as much self-care as we can. Is that a fair enough conclusion?
Absolutely, but the more we support our neurotransmitter functions, the more capable we are of doing the inner child work and of doing the healing work.
Bravo, right, because no amount of therapy is going to heal a hungry brain, right?
Exactly.
Yeah,
exactly.
Right. Pardon me, the one that you've...
That's not 1,000% true.
Okay.
Okay, it's mostly true.
I'm with you.
Where it's not true is that the more trauma healing we do, the less the inner child work, the EMDR, all of this, somatic work, all of that, the more we clear out of the trauma from the nervous system, the less drain there is on your neurotransmitter systems. So the less supporting of it from the outside we need to do.
Right.
And, there's also some indication that, the relationship in the psychotherapeutic relationship, hugging, which is not generally part of the psychotherapeutic relationship, right? But these experiences of safety, of being held, right, of love actually seem to encourage production, not just firing, but production of neurotransmitters.
Very good. Dan Siegel, what are his 4 S's? Seen, safe, soothed, and secure. Okay, thank you for the time. I'm thrilled to be here with you. I'll be signing up for the 2 days. What was the daytime one again? I'm sorry, the mood brightener. You yourself have said you started with that one.
Tyrosine?
Yes, I've been adding in tyrosine during the day on an empty stomach. Does that sound advisable?
Yep, absolutely.
All right. Thanks, everybody.
Okay, you're welcome. I'm so glad you shared, Sherry, and I'm so glad you woke up this morning. Okay.
I know, what
May
a
it
delight.
continue. Yeah.
Thanks, everyone.
All right. Oh, we just lost Marinella. Oh, okay. Hopefully she'll come back. Any other questions or comments? Yeah, Jeff. And Christy, do you have anything? Oh, good. There we have Marinella. Let's go with Marinella first, Jeff, and then we'll come back to you.
Hi.
Okay, go for it, Marinella.
Hi, thank you. So my mother has leg pain only at night, at bedtime.
You got
so
that.
It's very interesting because she lies down. She has some problems with the cervical spine and she has vertigo and with the lumbar spine, but nothing in particular. And she lies down in the daytime also, but she doesn't have any of these problems, nothing in the daytime, absolutely nothing. It's all at the bedtime in the nighttime. So, and the only thing that helps is Panadol, acetaminophen. So do you hear me?
Yes. So acetaminophen, of course, is a anti-inflammatory.
Yes.
Which would indicate to me again that it is a nerve issue.
Mm-hmm.
Because when we have tissue inflammation, it impinges on the nerve and can cause pain.
Yes. But why is it only in the nighttime?
So this is where the trauma therapist, and again, I mean, if we're looking at it physiologically, I would think mattress, position that she sleeps on the mattress, you know, all of that.
She tried other positions, and the thing is that when she's stressed, with physical stress, when we have a storm or raining and sounds and things like this, she's very stressed about it, and she hurts all over her body. Or when she hears some news, troublesome news, something disturbing, she has pain all over her body, like heart, limbs, arms, thorax, back, legs, shoulders, everywhere.
So I've got a couple of thoughts. One, that the trauma therapist in me is sort of waving her hand. And
yes, we tried, but she didn't really like it, so we dropped it.
May I ask what specifically you tried? What type of trauma therapy you tried? Pardon?
Cognitive therapy.
Yeah, cognitive therapy isn't going to touch this. Okay.
I don't know.
Cognitive therapy is not designed to heal trauma that's stuck in the nervous system. Okay. One of you may want to check in with Amy Apigian's work.
Okay.
Yes, Sherry, exactly. Amy Apigian has just put on a summit called The Biology of Trauma. And she really goes into a great deal of depth about this. I mean, about sneeze. Excuse me. Along with GABA support, though, I would also go with endorphin support. Did anybody else hear that? So because the endorphins are what give us help with both pain relief, okay, but also with feeling comforted and soothed.
Okay.
And especially if your mother had early childhood trauma, right now you haven't shared anything about your mother's trauma history, but early childhood trauma and
No, she
abandonment
didn't have. No.
Can lead to the inability to self-soothe when there is fear, when fear comes up. And inability to self-soothe is actually connected partially to the endorphin system.
Okay.
And so bringing in dephenylalanine at bedtime or DLPA during the day, if you can get it, would be worth experimenting with. And I would go.
Safe?
It's very safe, yeah. I would go quite high with the dose of the dephenylalanine, like I'd even maybe do 1,000 milligrams 3 times a day, and just along with some GABA, and just see what it does.
How many milligrams?
1,000. I would go high. I mean, you can start low and then build, but I would end up high with the dephenylalanine and just see what happens.
How many times a day? 2 times a day?
At least 1,000 milligrams before bed.
Before bed.
Yeah, I would start with that. And then I would bring in probably 1,000 milligrams once or twice a day before that, just to see. Maybe give it a week. And see if
yes, a good question here. She takes Parkinson's disease medication, Madopar.
Yeah, it shouldn't interfere with that.
It shouldn't interfere. Okay.
No, if anybody knows anything different, please jump in, but it shouldn't interfere with that.
Okay.
Yeah, and then GABA. And you start low with GABA, like 100 milligrams, and then you build, or you use the TrueCalm. I think the TrueCalm has 200 milligrams per capsule of GABA, which is still a pretty low dose.
This is before bedtime also?
Before bed, yep. Is she doing any other medication for sleep?
No, she was taking Zoloft for Parkinson's along with Madopar, but this didn't help really. And
so the other thought I have is to bring in, how many of the omega-3s is she getting? Or is she doing a lot of cold water fish? I would bring in I would bring in 4 grams of good quality fish oil.
Okay.
Whatever you have access to there. I like Nordic Naturals, or Carlson as a brand, but whatever you have, high dose.
I have FMDs, Canada.
Yeah,
FMDs I have access here.
Yeah, I don't know.
You don't know.
But I would do 4 grams a day, spread with food, maybe 2 grams with breakfast, 2 grams with dinner. Because if the acetaminophen is working, there's an inflammatory process as part of this. Okay.
I see.
We don't know where, but we know that. Okay, because otherwise the acetaminophen wouldn't work.
I thought because acetaminophen, we call it paracetamol here in Europe, because it works. I thought it blocks the serotonin pathway. So I thought it was something close to serotonin. So maybe a tryptophan, something with tryptophan, because it's only in the nighttime. So tryptophan interferes also with melatonin and serotonin.
Well, yeah, we'd have to talk about that a little more precisely. The first step I would do is bring in the fish oil because it's anti-inflammatory.
Okay.
Okay, I would do that. I would do the dephenylalanine and the GABA. for about a week, maybe all 3 for about a week. See if anything changes.
Okay.
And then
Okay.
email me or WhatsApp me in a week and let me know where things are, and then we can go from there.
One question, is safe GABA with DLPH with Parkinson's medication altogether?
Hyla or Valsa, do you have any comments about the Parkinson medication combination? I think it would be fine because it's working on different pathways, but what do you ladies think?
So, okay. So I'm not sure actually, because I wonder, like Parkinson's itself is a condition of neurotransmitter issues, right? So whether some of this is due to that, and of course, as you mentioned before, Parkinson's is due to excess oxidative stress, so glutathione is important. The way I like to do is I like to test, and I just don't try to guess like the different things so I do a lot of testing in my practice, and especially for a complicated patient with Parkinson's, I really try to see what could be the underlying cause of different things. And leg pain can be so many different causes, including for some people iron. So I hate to comment.
Tests? Also, what tests would you suggest you run?
So for probably a full metabolic panel, nutritional panel, and something like an ion test or a NutriVal that Genova has, ion NutriVal. Those are those tests that I like. And then, even before you give fatty acids, is to check a fatty acid level.
I was thinking a fatty acid profile. And
I love the ion. I love to look at nutrition, mitochondria. Parkinson's and some of these chronic diseases are really chronic because there's so many different components that could be in play or deficient or excess.
Well, the NutriVal is really interesting because it looks at all your different nutrients as well as an organic acids test. So I can definitely see that. Can you get that either in Greece
I don't know.
Can you order that from here?
Where are you? Where are you located?
She's in Greece.
You might be able to, because if you can't get Genova, you might be able to. You can look them up online. There's another company called Great Plains. They're more international. Great Plains Lab. And they might not have the entire thing that a NutriVal that's by Genova has, but they have organic acids. And I know Great Plains is more international, so you can try to get it there.
There's also a laboratory in Amsterdam, and I don't know all of what they do.
Okay.
It's research, it's nutrient research something in Amsterdam.
Yeah.
Do you know that, Valsa?
Yeah, there's actually Nordic labs. They're all over. Now that you reminded me, they're in Europe, and they're like a DHA. They aggregate the different labs, and so you can go to Nordic labs. I think that's what they're called, and through them you can order different labs. And I think they're also international. They are international, and you can get them in the States also. But you can
Nordic labs. Okay.
Nordic labs, and they're really such a good group. I love everything that they do, and they might have different labs within their umbrella, like the DHA labs kind of setup, I think.
Okay, so I need this NutriVal test. Okay, thank you.
Yeah, it's not easy to read either NutriVal, but at least you'll get an idea. And if you order it, someone will help you. The consultant in that lab will help you. But all of these labs are quite complicated to actually analyze and read, just FYI.
And next month you can bring it and run it past us.
Yeah, okay. I wanted to ask you also about the microbiome.
Always, right? Always. But an organic acids test, is going to give you a peek into your microbiome. And then a comprehensive stool analysis would give you an even better assessment of what's happening.
Mhm. Do you think, because I heard Professor Emeran Meyer talking about this, he said that one species of lactobacillus decides how tryptophan is metabolized in the gut, if it takes the pathway of the serotonin or kynurenine or
Sure. Well, that's where an organic acids test is going to tell you, okay, what pathway it's going down. And a comprehensive stool analysis will tell you what.
So I think she's missing some.
Well, that could be. So it's you froze for a minute, so I don't know if you heard me. The organic acids test is going to tell you what's happening with the tryptophan pathway. Okay. And the comprehensive stool analysis is going to show you exactly the composition of various things. There's other tests as well that can show you the composition in your gut. Okay, we are having connection issues in Greece. Other questions while we're waiting for her to come back? Jeff.
I have a very quick question. But it's a little confusing. I've never heard of it before. And that is, I heard from a client, I talked about diphenylalanine. She got diphenylalanine. And then she said on the bottle, it says take 3 hours apart from any other amino acid. And I hadn't heard anything about that before. And I was wondering, how do I navigate this?
That's the empty stomach thing again. That's, to make sure there's no competition and things are absorbed, efficiently to take amino acids on an empty stomach. So best of all possible worlds, yeah. Real world, whatever.
So the question was about like taking diphenylalanine separate from any other amino acids.
Well, that's what I'm saying. The rule of thumb is that we always take these individual amino acids on their own so that there's no competition as to uptake.
Okay.
The reality is that most of the time it gets to where it's going anyway. Okay, so, this is why they sell DLPA, right? Where you're taking the DPA with another amino acid, and yet it still works.
Yeah.
Okay.
Yeah.
So, are you going to be a stickler or are you going to live in the real world?
Okay, thank you.
And when you can be a stickler, that's great and that's wonderful. It's just, it doesn't always work that way. Okay, other Mafalsa, yeah.
So I have a question. I have a patient who's coming off a benzo and is having a real hard time sleeping. I don't know if you have any herbals or any kind of suggestion, like something that's worked, high dose GABA, theanine, valerian, all the herbals. So
Valsa, here's how you think through it. You want to ask her what her insomnia experience is like, because that's going to tell you which neurotransmitter systems are impacting her sleep, or what else it might be. So if it's the anxious, agitated worry, right, that's going to be a sign of low serotonin, and you're going to need to support serotonin at bedtime.
So the issue is that the patient is having a lot of stomach upset. I don't know if anyone has heard of like a benzo belly. This is what he's saying he has, like coming off. And so he's not able to tolerate amino acids. So then we are stuck. And so we're trying to figure out what this. So for
Okay,
the
well, so
benzo belly,
you still need to, okay, so is it the tummy upset that's keeping this person awake at night, or is it something else?
it's not the tummy upset, but right now what's happening is that he cannot take any amino acids.
I got it.
Because whatever he takes, it just creates a lot of pain for him.
Okay, so I'm going to come back around to that statement because we might be able to address that.
The benzo belly?
Yes, the benzo belly.
Okay,
Or
that
at
would be
least-
actually the first thing, because if we can address that, he can at least take the amino acids.
Well, yes, but you still have to decide which amino acids you need. Okay. And to do that at bedtime, you ask what the person's insomnia experience is like. Are they staying awake, or can they not get to sleep because of the obsessive worry and obsessive thinking? That's number one. That's the active brain. Can they not get to sleep because physically their bodies can't relax and slip into sleep? Do they stay tense and wired physically? That's a sign of low GABA. Thirdly, is it either is it high cortisol and high adrenaline, either due to stressed adrenal function, where we've got too much cortisol production at bedtime, which could be very possible during a benzo withdrawal, okay? In which case you would bring in Seraphos and theanine, and I know we're coming back around to that. But first of all, we want to identify what the issue is. Or is it adrenaline because of low blood sugar? So those are our four options, typically. Now, I'm sure there's others, but those are the four things you want to identify. Which one or combination of these is driving the insomnia? Now, once you've done that, then you can decide what herbs or nutrients you want to bring in. Because if right now, until we address the benzo belly, he can't tolerate amino acids on their own, you've got St. John's wort, you've got the 4 low serotonin. Or
Can
maybe
you take it with an SSRI?
Pardon?
Can you
If the
take it with an
SSRI,
SSRI?
if it's in the morning, if the SSRI is in the morning, then you can cautiously try the St. John's wort at bedtime. So that there's at least that 6-hour spread, to protect against serotonin syndrome. But as always, if we bring in more serotonin support to an SSRI and they start showing signs of serotonin syndrome, it means that they're already living on the edge of serotonin syndrome and their meds are already too high. And that's where you need to start. Because a little bit of support should not tip people over. Now, benzo belly, we've got some sort of inflammation going on.
So that's for?
Well, wait, I want to start. So the question is, can he tolerate amino acids taken with food? Or is food itself being distressing?
Right now.
Okay, what tummy soothers are you bringing in?
Sorry, what?
What tummy soothers? So you've got the GI, whatever it's called, from Designs for Health.
Right. So we tried a lot of things. We tried slippery elm, aloe vera, and so those were the other things. So this time I asked him to try zinc carnosine, and those were the ones that we tried. Then, like from the conventional point of view, I sort of said Pepto-Bismol, sucralfate. Those also works from the conventional.
Okay, so how does the Pepto-Bismol work?
It just coats the stomach.
I know. Does it help?
lining.
Yeah, is it helping?
Oh, you mean for him personally? No, it hasn't helped. None of those help. The slippery elm, aloe, and Pepto-Bismol hasn't worked. So now I asked him to try zinc carnosine. He tried a little bit of ACV. He tried a little bit of just thinking that could it be.
What about either DGL or glutamine?
Glutamine he's on. I asked him to restart it. It hadn't really helped him before. So he's on glutamine. He's taking it anyway.
I would do it anyway, because even if it doesn't help immediately, it may help long-term because the enterocytes use it as fuel.
Yeah, he's been on that for months, actually. That's because of, low blood sugar, and he likes the glutamine. But what do you know about benzo belly? This, like, what's the cause of that?
I don't. Sherry, Jane, Jane, you had your hand raised?
Well, I was gonna say I've dealt with belly issues for a very, very, very long time. So just struggled with those things. One of the things that has been most helpful in calming my gut down is doing an external castor oil pack on a regular basis, 3 to 5 nights a week, because it takes out the inflammation in my gut. It reduces the scar tissue. It helps my liver to process out the things that are causing me distress. I cannot tell you if I had like one treatment that I handed out like to everybody without, and there are some times when you shouldn't use it, but like literally every one of my nutritional clients, we pretty much always start with a castor oil pack if they're dealing with any kind of belly inflammation, because it is incredible for reducing the pain and the problems.
So do you take it, so you buy the castor oil, you buy those
The flannels
that come with it, right? And
yes.
then you apply it, you put it on top of the right upper quadrant, and then you just cover it.
But with a belly, I do my whole belly. So I don't just do my liver because I have had C-section. So I do my C-section scars, but I do my whole belly because of where the pain is. And then you can do the flannel and then cling film and heat over the top for 45 minutes. But what I've switched to now is I have a kit that, like, literally they make these kits with the pack cover on it, so you can Velcro it on and sleep in it all night without having to do the heat. And it's been so helpful.
And who makes that kit?
I'll look it up. It's just an Etsy, a gal on Etsy. She makes the kits. I'll look her up right now and I'll put the link in the chat.
Physicians Research Lab has some sort of kit, but I think the flannel is a very small. It doesn't like go across the whole belly.
This gal makes them to size. So I'm 5'2" and I have a very short torso, and she made it so it fits me. So it's really how you just give her the measurements. And so if you've got a bigger, taller person or somebody that you need to cover the whole belly, it's going to fit because it'll be made to them.
And so you put the castor oil, you cover it for 45 minutes or the whole night, and that's okay.
Yeah.
And do you know about, is this for, I know you talked about this in general, but does anyone know about the benzo belly in particular, like the cause of it, or has anyone dealt with it? No?
No, but also in the chat, I was directing you, if it's of any interest, to Chris Page. He's a therapist who's online, who's gone through his own benzo withdrawal, and he's pretty informative if you feel like looking him up.
Okay, thank you.
You're very welcome.
So Christina, so St. John's Wort, if he's able, so I'm going to actually suggest the castor oil pack, but in terms of the herbals for sleep, you mentioned St. John's Wort, anything?
Well, so then you've got your different sleep herbs, which work differently. Okay, but most of them, St. John's Wort is about the only one I know that works specifically on serotonin and therefore melatonin. But the others work on GABA. And so you've got valerian, which definitely fires GABA and is more of a muscle relaxant as well. Passion flower is, I forget exactly its mechanism of action, but it's sort of more for your wired personality. Skullcap is a calmer that is also a anti-inflammatory. Lemon balm may be a possibility here because, and chamomile, because they are a slightly anti-inflammatory topically as they go down the GI tract. But they're both also soothers, nervines. So a combination with chamomile, lemon balm, hops, all of those can be really, really, really useful. And you can make a tea out of them. in traditional medicine, you put hops in a bag under your pillow. And traditionally, sleeping on hops is supposed to help with sleep. I'm not quite, I mean, it may be the fragrance, right? We may have an aroma issue there. But anyway, those are your major, those are your major sleep herbs. And they can be soothing during the day too.
Yeah, I also have never heard of the benzo belly, and just I wanted to go the conventional route and working up this GI pain. And he's like, no, there's all these discussions in these forums apparently about benzo bellies.
Well, you still want to maybe go a conventional route to figure out what is it's causing. But we also know, Valsa, that low GABA is implicated with IBS. So, you know, I mean, it could just be low GABA. But I'm curious as to, I mean, if you did say a full conventional workup, right, like an endoscopy, you could find out where the inflammation is, maybe. Because if he has trouble eating, then there's at least inflammation in the stomach. We don't know whether the inflammation also gets to the intestines. If he can't tolerate aminos because they're too acidic, that's inflammation in the tummy. And so really working long-term with your tummy anti-inflammatories, and who knows, maybe he has an ulcer.
Right.
Right? And maybe doing a full ulcer, maybe you do need to do an endoscopy. Figure out if the guy has an ulcer. Because if he can't tolerate supplements on an empty stomach or food, that means that the inflammation is in the actual stomach. So that's my common sense approach to this.
Christina?
Yeah.
Sorry, you were frozen for a couple of seconds. What's the 2-day seminar? I think I missed the announcement for the seminar.
It is what you already did, because you came in through one of the weekend seminars, didn't you?
Yeah. Oh, it's
yeah.
Okay.
So it's just the lecture content of level 1. So it's our weekend seminar, but we're doing it virtually rather than in person. And so if any of you, all of the information will be on the website and mailed out to our entire mailing list on Monday. So if any of you know people who want to, you know, just get their toes wet and have a, you know, 2-day brain dump, this is a really fast way to get the information. You're not going to be taught how to use it, but you're going to get all the basic information. So, and that's how Valsa came into our community, because she did one of the weekend trainings with us. Wonderful. We'll look forward to having you. Although our Thursday night might be a little tricky for you, though, I still want you to try to come to it, Marinella, because it's where we're introducing ourselves to everybody. Okay, anything else before we stop for the day?
Hi, could you put the details of the weekend training in chat? Because I
will, although, you know, it's all going to be mailed out on Monday.
Oh,
But
okay.
November.
I think it was the 10th and 11th.
Well, it's the evening of November 11th, plus all day the 12th and all day the 13th. And I think it's $998 early bird price, 11 something like $11.98 non-early bird price. And you can use that towards your tuition for the spring training as well. Okay, anything else? Any other questions or comments before we stop for the day? Wonderful combination or conversation, wonderful questions, great help from other members of the community. Thank you so much.
Thank you very much. I learn something new every time I come on. I always leave with all my little post-it notes with all the little things I learned. So thank you very much.
You're so welcome. So glad.
Thanks,
All right,
everyone. This was
bye-bye, everybody.
wonderful.
Thanks
you
for
later.
such a rich group. I'm not really at a pool, by the way, but Southern California and Greece are sounding very nice today.
Indeed. Okay. Bye-bye, everybody.
Bye, thank you.